Good afternoon to everyone. To all the participants attending the session, I am Dr. Samriti Chauhan, Assistant Professor from School of Physiotherapy, is here to share an informative presentation on the topic ABG and its analysis. So, before starting with the main content, I would like to explain what ABG is. ABG stands for arterial blood gas. It is a test that measures the oxygen tension, carbon dioxide tension, acidity, oxyhemoglobin saturation, and bicarbonates concentration in arterial blood. It is a blood test to study the levels of acidity, oxygen, and carbon dioxide in the blood before it is transported to the tissue in our body. By interpreting arterial blood gases test results, doctor can determine the state of the body's lung and kidney function. So, here are some indications for ABG test. Number one, for diagnosis of respiratory, metabolic, and mixed acid base disorders. Number two, to monitor the patient's acid base status. Number three, for the assessment of the patient's response to treatment strategies such as mechanical ventilation. And the last one, to diagnosis and managing the patient's oxygenation status, ventilation failure. Here are some contraindications for ABG test. Number one, obstructing thrombus. Anytime an arterial puncture is made, which increases the risk of causing obstructive thrombus in the artery. Infection. Areas of skin infection should be avoided because of the risk of inoculating the blood with bacteria. Anticoagulants. Patients on anticoagulants and those with coagulopathies are at risk for severe bruising and hematoma formation in the body. Patients with poor collateral blood flow. Now, here are some components of ABG: pH, PCO2, PO2, and bicarbonates. So, first we will discuss about pH. What is pH? It is the concentration of hydrogen ions and which determines the acidity or alkalinity of body fluids. The normal ABG level for pH is 7.35 to 7.45. A pH of 7.35 or less than 7.35 indicates acidosis, and a pH greater than 7.45 indicates alkalosis. Next is your partial pressure of carbon dioxide, which shows the adequacy of the gas exchange between the alveoli and the external environment, which is also known as alveolar ventilation. Carbon dioxide cannot escape when there is damage in the alveoli. Excess carbon dioxide combines with the water to form carbonic acid, which causes an acidotic state in our body. When there is hypoventilation in the alveolar level, like in COPD, the partial pressure of carbon dioxide is elevated and respiratory acidosis results. On the other hand, when there is alveolar hyperventilation, the partial pressure of carbon dioxide is decreased, which causes respiratory alkalosis. For partial pressure of carbon dioxide, the normal range is 35 to 45 mm of Hg, and which is respiratory dominant. Next one is your PaO2, that is your partial pressure of oxygen, indicates the amount of oxygen available to bind with hemoglobin. The pH plays a role in combining power of oxygen with hemoglobin. A low pH means there is less oxygen in the hemoglobin. For partial pressure of oxygen, the normal range is 75 to 100 mm of Hg. Next is your oxygen saturation, which is measured in percentage. It is the amount of oxygen in the blood that combines with hemoglobin. It can be measured indirectly by calculating the partial pressure of oxygen and pH, or measured directly by co-oximetry. For oxygen saturation, the normal range is 94 to 100%. Next component is your bicarbonate. It is an ion and it is alkaline substance that combines over half of the total buffer base in the blood. A deficit of bicarbonate and other bases indicates metabolic acidosis in your body. Alternatively, when there is an increase in bicarbonates present, then metabolic alkalosis results. Here are some normal values in ABG. For pH, the normal range is 7.35 to 7.45. For partial pressure of carbon dioxide, the normal range is 35 to 45 mm of Hg. For partial pressure of oxygen, the normal range is 75 to 100 mm of Hg. For bicarbonates, the normal range is 22 to 26 milliequivalents per liter. Oxygen saturation, the normal range is 94 to 100%. If the pH in our body is having the normal values, then it will be the normal, no abnormality in our body. But if the pH value is low in our body, it will cause acidemia. And if the pH value increases in our body, it will cause us alkalemia. Now, we will start with ABG interpretation. Interpreting ABG is used to detect respiratory acidosis or alkalosis or metabolic acidosis or alkalosis during an acute illness. To determine the type of arterial blood gas, the key components are checked. The best and the fun way of interpreting arterial blood gas is by using the tic-tac-toe method below. So here are the goals of ABG analysis. We will first check whether it's acidosis or alkalosis. Second goal is we will check whether it's metabolic or respiratory condition. And number third, we will check about that whether it's fully compensated, partially compensated, or uncompensated. So here are the few steps how we will interpret the ABG. So number one, determine if the pH is under normal acidosis or alkalosis. Number two, determine if partial pressure of carbon dioxide is under normal acidosis or alkalosis. Number three, determine if bicarbonates is under normal acidosis or alkalosis. Number four, determine if metabolic or respiratory. Determine the compensation. Here is one example. We have values for pH, partial pressure of carbon dioxide, and bicarbonates. So your first step is that you should remember the values. Now make a tic-tac-toe grid. So here the pH is 7.26, which is less than 7.35. So we will put this value under the grid acidosis. Now we will check for the value of partial pressure of carbon dioxide. It is 32 and which is also less than 35. So it will come under alkalosis grid. Now we will check for the values of bicarbonates. So it is 18 and it is less than 22. So it will come under the grid acidosis. So pH is on the same column as bicarbonates. Therefore, we have metabolic. All three values are abnormal. Therefore, we have a partially compensated ABG. So the result for this example is metabolic acidosis partially compensated. Acid-base balance and imbalances. Acid-base imbalances develop when a person's normal homeostatic mechanism are dysfunctional or overwhelmed. One type of acid-base imbalance is acidosis, wherein the blood is relatively too acidic and the value of pH will be decreasing in acidosis state. The body produces two types of acid. Therefore, there are two types of acidosis. One is your respiratory acidosis and another one is your metabolic acidosis. On the contrary, alkalosis is a condition wherein the blood is relatively too basic, where the pH value will be increasing. There are also two types of alkalosis, respiratory alkalosis and metabolic alkalosis. When acid-base imbalances occurs, the body activates its compensatory mechanisms to help normalize the blood pH. The kidneys compensate for respiratory acid-base imbalances, while the respiratory system compensates for the metabolic acid-base imbalances. This does not correct the root cause of the problem. If the underlying condition is not corrected, this system will fail. So we will discuss about respiratory acidosis, which is also known as primary hypercapnia. Respiratory acidosis is acidemia where the pH value is less than 7.35 due to an increase in the carbon dioxide tension in bodily fluids. It is characterized by an increase in partial pressure of arterial carbon dioxide due to alveolar hypoventilation. Respiratory acidosis occurs when breathing is inadequate, which is also known as alveolar hypoventilation, and the lungs are unable to excrete enough carbon dioxide, which will cause partial pressure of carbon dioxide or respiratory acid builds up in our body. The extra carbon dioxide combines with water to form carbonic acid, causing a state of acidosis, a common occurrence in emphysema. The kidneys activate its compensatory process by increasing the excretion of metabolic acids through urination, which increases blood bicarbonates in our body. There are two types of respiratory acidosis. Number one, acute respiratory acidosis and chronic respiratory acidosis. So, what is acute respiratory acidosis? It is a form of respiratory acidosis which occurs immediately and it is left untreated, then symptoms will get progressively worse. It's a medical emergency and can become life threatening. Chronic respiratory acidosis, this form of respiratory acidosis develops through time. It does not cause symptoms. Instead, the body adapts to the increased acidity. For example, the kidneys produce more bicarbonates to help maintain balance. Chronic respiratory acidosis may not cause symptoms. Developing another illness may cause chronic respiratory acidosis to worsen and become acute respiratory acidosis. So here are some risk factors for respiratory acidosis. Basically, the respiratory acidosis is caused by the underlying disease in our body. Number one, hypoventilation. A decrease in ventilation increases the concentration of carbon dioxide in the blood and decreases the blood pH, and it can be caused by brain trauma, coma, or hypothyroidism. Another is your chronic obstructive pulmonary disease, which is also known as COPD. In those patients, the body tries to compensate by retaining more bicarbonates to overcome acidosis. Next is your respiratory conditions. The lungs are not able to eliminate enough of the carbon dioxide produced by the body. So, excess carbon dioxide causes the pH of the blood and the other bodily fluids to decrease, making them too acidic. And it will occur in some cases like pneumothorax, pneumonia. Next is your drug intake. Overdose of an opiate or opioid such as morphine, tramadol, heroin, fentanyl, or magnesium sulfate can cause respiratory acidosis. Here are some signs and symptoms. Altered level of consciousness. Respiratory acidosis may be the result of an altered level of consciousness caused by encephalopathy or cerebral edema. Confusions. Acute respiratory acidosis may also cause symptoms involving the brain, including confusion, stupor, drowsiness, and muscle jerks. Disorientation. Respiratory acidosis may result in disorientation, headache, or even focal neurologic signs. Next one is your coma. When the lungs cannot remove all the carbon dioxide produced by the body through normal metabolism, The blood becomes acidified, leading to increasingly serious symptoms from sleepiness to coma. Tremors manifest as shaking or jerking muscle movements. Asterixis and ability to maintain the posture of the part of the body. Management for respiratory acidosis is first we will treat it with medications. Bronchodilators, medicines, and corticosteroids may be used to reverse some types of airway obstruction, like those linked to asthma and COPD. Weight loss. In the case of obesity, hypoventilation syndrome, significant weight loss may be necessary to reduce abnormal compression of the lungs. Provide mechanical ventilation through oxygen supplementation. Additional oxygen may be provided to elevate the low oxygen level in the body. Manage hyperkalemia through the use of kieselate. Acidosis causes potassium to move from cells to extracellular fluid in exchange for hydrogen ions, and alkalosis causes the reverse movement of potassium and hydrogen ions. Kieselate increases fecal potassium excretion through the binding of potassium in the lumen of the gastrointestinal tract. Maintain adequate hydration, provide intravenous fluids and electrolytes as ordered. So next is your respiratory alkalosis, which is also known as primary hypocapnia. It is alkalemia due to a decrease in arterial pressure of carbon dioxide. It is the result of alveolar hyperventilation relative to carbon dioxide production. Respiratory alkalosis can result from hyperventilation since the lungs excrete too much carbonic acid, which increases pH in our body. Since respiratory alkalosis occurs quickly, the kidneys do not have time to compensate for this mechanism. Neurological symptoms such as confusion, paresthesia, and cell membrane excitability occur when the blood pH, CSF, and ICF increases accurately. Here are the causes of hyperventilation include panic. Panic attacks and anxiety are the most common causes of hyperventilation. Another is your hyperthermia. Fever may manifest as hyperventilation. The exact mechanism is not known but is thought to be due to carotid body or hypothalamic stimulation by the increased temperature in our body. Brainstem damage. Central neurogenic hyperventilation is the human body's response to reduced carbon dioxide levels in the blood. This reduction in carbon dioxide is caused by the concentration of cranial arteries from damage caused by lesion in the brainstem. Another is your metabolic acidosis. Hyperventilation occurs most often as a response to hypoxia, metabolic acidosis, increased metabolic demands, pain, or anxiety. Pregnancy. Progesterone levels are increased during pregnancy, and the increase in this hormone will cause stimulation of this respiratory center, which can lead to respiratory alkalosis. Signs and symptoms. Hyperventilation is a sign that respiratory alkalosis is most likely to occur. However, low carbon dioxide levels in the blood also have a number of physical effects, including numbness, that is, an increased muscular irritability in which a person loses feeling in a particular part of their body, tingling sensation or prickling sensation that is usually felt in the hands, arms, legs, or feet, but can also occur in other parts of the body. Palpitations are the perceived abnormality of the heartbeat characterized by awareness of cardiac muscle contractions in the chest. Tetany or tetanic seizures is a medical sign consisting of the involuntary contraction of the muscles. Convulsions, a medical condition where body muscles contract and relax rapidly and repeatedly, which will result in uncontrolled actions of the body. Signs and symptoms of hypokalemia and hypocalcemia. Persistent respiratory alkalosis can induce secondary hypocalcemia and hypokalemia that may cause cardiac arrhythmias, conduction abnormalities, and various somatic symptoms such as paresthesia, hyperreflexia, convulsive disorders, muscle spasm, and muscle twitching. Management for respiratory alkalosis includes the treatment for respiratory alkalosis depends on the underlying cause. Treating the condition is a matter of rising carbon dioxide levels in the blood. The following strategies and tips are useful for respiratory alkalosis caused by overbreathing due to panic and anxiety. So we can go with breath into a paper bag. Breathing through a paper bag fills it with carbon dioxide, helping in inhaling exhaled air back into the lungs. Treat underlying conditions with medications. Administering an opioid, pain reliever, or anti anxiety medications to reduce hyperventilation. Relaxation techniques like breathing exercises, which can help in relaxing the lungs and breath from the diaphragm and abdomen rather than the chest wall. Safety, stay with the patient, correction of hypokalemia and hypocalcemia, oxygenation as indicated, providing oxygen to help keep a person from hyperventilating. Next imbalance is your metabolic acidosis. Metabolic acidosis is when there is a decrease in bicarbonates levels in our body and a buildup of lactic acid occurs. This happens in diarrhea, ketosis, and kidney disorders. It has three main root causes: increased acid production, loss of bicarbonate, and a reduced ability of the kidneys to excrete excess acids. Risk factors for metabolic acidosis are chronic renal failure and chronic hypoxia. Chronic renal failure is due to reduced tubular bicarbonate reabsorption and insufficient renal bicarbonate production in relation to the number of acids synthesized by the body and ingested with food. Chronic hypoxia. With chronic hypoxia, metabolic and hypercapnic acidosis develop along with considerable lactate formation and pH falling. Obesity, especially in conjunction with insulin resistance, can increase metabolic acidosis and thus results in reduction of urinary citrate excretion. Diarrhea, loss of bicarbonate stores through diarrhea or renal tubular wasting leads to a metabolic acidosis state characterized by increased plasma chloride concentration and decreased plasma bicarbonate concentration in our body. Dehydration, electrolyte disturbances in our body will cause prolonged vomiting or severe dehydration, which will result into metabolic acidosis. Aspirin toxicity, aspirin overdose causes the body to not produce ATP, leading to anaerobic metabolism with consequent raised lactate and ketone bodies. Acute aspirin or salicylate overdose or poisoning can cause initial respiratory alkalosis through metabolic acidosis, ensues thereafter. Next one is your methanol poisoning. Significant methanol ingestion leads to metabolic acidosis, which is manifested by a low serum bicarbonate level. The anion gap is increased secondary to high lactate and ketone levels. This is probably due to formic acid accumulation. Signs and symptoms: altered level of consciousness, confusion, disorientation, lack of appetite, coma, and jaundice. Management for metabolic acidosis. Patients with arterial blood gas indicating metabolic acidosis are managed and treated by sodium bicarbonate, indicated in the treatment of metabolic acidosis, which may occur in severe renal disease, uncontrolled diabetes, circulatory insufficiency due to shock or severe dehydration, extracorporeal circulation of the blood, cardiac arrest, and severe primary lactic acidosis. Treat the underlying condition. Hydration for diabetic ketoacidosis. The major treatment of this condition is the initial rehydration. Dialysis for chronic renal failure. The control of the metabolic acidosis in hemodialysis is mainly focused on the supply of bicarbonates during the dialysis session, use of diuretics, Kysalates, acidosis causing potassium to move from cells to extracellular fluid in exchange for hydrogen ions, and alkalosis causes the reverse movement of potassium and hydrogen ions. Next imbalance is your metabolic alkalosis. It occurs when bicarbonate ion concentration increases, causing an elevation in blood pH. This can occur in excessive vomiting, dehydration, or endocrine disorder in our body. Risk factors for metabolic alkalosis are vomiting, which causes metabolic alkalosis by the loss of gastric secretion in vomiting, which are rich in hydrochloric acid. Whenever a hydrogen ion is excreted, a bicarbonate ion is gained in the extracellular space. Sodium bicarbonate overdose. Administration of sodium bicarbonate in amounts that exceed the capacity of the kidneys to excrete this excess bicarbonates may cause metabolic alkalosis, hypokalemia, due to a low extracellular potassium concentration. Potassium shifts out of the cells in order to maintain electrical neutrality. Hydrogen shifts into the cells and raising the blood pH. Nasogastric suction, just like in vomiting, nasogastric suction also generates metabolic alkalosis by the loss of gastric secretions, which are rich in hydrochloric acid. Signs and symptoms for metabolic alkalosis includes people with this type of alkalosis more often complain of the underlying conditions that are causing it. These can include numbness, vomiting, diarrhea, swelling in the lower legs, which is also known as peripheral edema, fatigue, tingling sensation, agitation, disorientation, seizures, coma. Management. We can give antiemetic in case of vomiting, administer antiemetics if possible. Ammonium chloride. Ammonium chloride is a systemic and urinary acidifying agent that is converted to ammonia and hydrochloride acid through oxidation by the liver. Intravenous ammonium chloride is a treatment option for severe cases of metabolic alkalosis. Acetazolamide also appears to be safe and effective in patients with metabolic alkalosis following treatment of respiratory acidosis from exacerbation of chronic obstructive pulmonary disease. Relevance to physiotherapy practice. Arterial blood gas interpretation is an important component of cardiorespiratory physiotherapy assessment. It will mainly help us to make a assessment for patients. Arterial blood gases provide physiotherapists with important information on the acid-base status of the body as well as how well the lungs are able to diffuse oxygen into and remove carbon dioxide from the blood. This information is important in determining causes of hypoxemia and can be used to inform physiotherapists when making a clinical diagnosing and formulating treatment plans. So basically, ABG will help us to identify the levels of oxygen and carbon dioxide in our blood. Thank you.